visceral organs really, or it's a sponchology. It's all organs after skin. But you remember muscles, bones, joints, you studying in the first semester. It was starting in a course of the human anatomy. And now we are speaking about visceral systems. Visceral systems, now it's really only 4 parts after musculoskeletal system 1, 2, 3, it's a muscles, bone and joints. Digestive system, for example, stomach located in a digestive system. It's a gastric stomach, but it's not one part of the digestive system. In a starting, it's a stoma and oral cavity. Next one, it's a pharynx, esophagus, stomach, small and large intestine. Rules for digestive system: 4 by 4. Together it's will be 16 organs of the digestive system. Very good if you will be remember and understand some organs with 4 parts. 4 parts in a 4 organs: stomach, duodenum, colon, and pancreas. Next one, it's really in the digestive system present in a modern terminology, digestive canal. Digestive canal starting really after pharynx. It's starting with esophagus and finish in a anus, in a rectum. Yes, and in a digestive system, 2 very important moment. It's a divisions and glands. In the divisions, stoma or oral cavity, pharynx, esophagus, red, yellow, green. Yes, some variant, very popular color in for remembering. Stomach and small intestine and large intestine. Small intestine, 3 parts: duodenum, jejunum, and ileum, and intestinum crassum, cecum, colon, and rectum. 3 parts in a small and 3 parts in a large intestine. But very important moment, it's a glands. Glands in the oral cavity, vestibular glands, and big and small salivary glands. Salivary glands, major or big, it's a submandibular, sublingual, and parotid, and small. How many small? You remember maybe how many small salivary glands in the oral cavity? Who remember? Really, it's a 5 types: labialis, buccalis, molaris, palatin, and lingualis in the oral cavity. And here it's a same schematic in a metro station. Yes, esophagus, but here present only a digestive canal with glands, liver, pancreas, and with appendix. And here some ways were connecting. What is the point here? Maybe you know what is the point where bile juice of the pancreas moving to the small intestine. What is a part of digestive tract?
Duodenum, no?
Yes, and which part of the duodenum?
The beginning, the pyloric part.
3 parts in a duodenum. It's will be superior, descendants, horizontal, and ascendants. Which part in a duodenum connecting with ducts of the pancreas and bile duct, common bile duct?
Superior?
No.
No.
No. Please remember, it's very important for different diagnostic. It's a descending parts. Here will be opening ducts of the bile duct and small 2 ducts with pancreas. Please remember this moment, it's very important too. And upper then duodenum, located stomach. And when you speak about some organs, vascularization and innervation, short information revise about stomach, it will be very good if you in the future created some presentation, for example, not only vascularization innervation, you very good if you will talk about some parts, some surfaces, yes, and very important, it's a diagnostic method. Gastroscopy, it's a special zondus with camera in the finish, and for example, it's very important when you understand what does it mean gastritis and perforation, and what structure will be in this variant connecting here, yes, ulcer, erosium, and perforated. Here, erosium, it's only connecting with mucous membrane. Ulcer, acute ulcer, it's when connecting with muscle layers, and perforated, really, it's an opening. And why very important, where located biggest vessels near small and large curvature, yeah, it's because when in this variant, yeah, find erosion near large, or other variant small, very popular near large curvatura. It's very dangerous because these vessels may connect it with, this is ulcer, and next one, walls of the vessels crush, and all stomach will be with blood. Next one, this is blood moving to the external, and what color this is blood may present in the external in this person. Same with coffee, really brown color, because connect with acid, yes, blood erythrocyte connect with acid and move into the external. And what is some method for emergency helping for this person? What is your opinion? It's may present silence located not in a horizontal, very good. And it's if this person will be sitting in flexible body position, press for this region in abdominal, and in a stomach, in epigastrium region may present located cold, yes. It's, for example, ice, and next one as a moment too. So next, about internal organs, I'm very short revise as a system, and we will talk next time in a digestive system. 10 organs, it's only starting with oral cavity to the rectum. Yes. Next one, you remember present liver, bile, vesica or bile. Gallbladder, yes. Pancreas, salivary glands, small and large. What does it mean, fauces? Who remember? It's a region, it's a some border between oral cavity and oropharynx. For vision, this variant I find here. This one, it's this is line here. Near uvula, if you remember, palatinum mole in the finish. Here it will be fauces. And next one, in a Finnish, very important, it's a peritoneum. Peritoneum, it's a serous membrane, and 3 types of the serous membrane present in the human body. It's a peritoneum, pleura, and here absent. Pericardium. Pericardium near heart, with 2 layers, visceral and parietal. Please remember this moment, it's very important too. Respiratory system, I understand today we talk about in the next time and about vascularization and innervation respiratory organs system 2, and first of nasus and cavitas nasi, pharynx and larynx. Really about pharynx, don't remember when subscribe respiratory system, but it's part nasopharynx, oropharynx, laryngopharynx. It's a way of the air to the bronchus in trachea and tonsil. Trachea, bronchi, pulmones, pleura, and mediastinum. Mediastinum, do you remember what is this moment about mediastinum? Here, it's a line between up superior mediastinum and inferior mediastinum, connecting manubrium sterni and body of the sternum, and it's to the superior surface, and line. Next point, it's between 4th and 5 vertebrae. This question, for example, will be in exam question test 2. Where located this is line, and you now looked in the picture where this is line will be present. And in the inferior mediastinum present anterior, middle, and posterior. Very simple. In a middle mediastinum will be present heart. Please remember this moment too. Okay, next one, it's if urinary system, it's very simple, number 6. Kidney, ureter, vesica urinaria, and urethra. Masculinum, femininum, male, female, and why 6? Because 2 kidney, 2 ureters, and 1 anterior organs, vesica, urinary bladder, and urethra. And in a genital system 7, because in a male and female together, if how many organs, one variant, it's a number 7 in a female, external vulva and clitoris, and in the internal vagina, glandular vestibular glands, uterus, metra, hystera, tuba uterina, pair organ, or salpinx, and ovarium, pair organ. Because it's a number 7 for remembering. And in a system, male genital system, and I replay genital system, not reproductive. Why? Because in a genital system, one with function, it will be a reproductive function. Not very correct if speaking about, and very popular in different books and atlas using reproductive system. Really, it's a not all, not correct name. Genital system, it will be correct name of the these organs. And external penis and scrotum, and internal testis, epididymis, ductus deferens, prostata plus vesiculis seminalis, glandula bulbourethralis, and ductus ejaculatorius.